Hi, my name's Courtney.
My name is Marvin. We're SPTA students, College of the Sequoias. We're going to be doing a video on elbow flexion.
Okay, so the first exercise we're going to talk about is elbow flexion. The muscles that participate in elbow flexion are biceps brachialis, and brachioradialis. And so I'm going to explain the exercise to you. So you're going to get a TheraBand, and with your ipsilateral leg, you're going to stabilize the TheraBand, and then with your other hand, with your palm facing up, you're going to have your elbow extended, and then you're going to bend it up towards you. And some parameters for that, we're going to do two sets of 10 once a day, 2 times a week, and start out with a light TheraBand. And then if you have no compensation, no pain, and good posture, then you can progress to medium TheraBand and add more reps and sets to that. And then some precautions. So we want to watch out for pain and swelling, and some contraindications because the biceps brachii is 2-joint muscle that crosses shoulder and elbow. And so we're going to watch out for fractures and injuries in those areas. So I'm going to have Marvin demonstrate what I just did. Go ahead and picture. Okay, so the next exercise we're going to talk about is elbow extension. So the 2 muscles that participate in elbow extension is triceps and coneus. So triceps is the prime mover of elbow extension, and coneus is it just assists in elbow extension. So the first thing we're going to do is you're going to find a stationary object such as a doorknob, and you're going to make a loop on your TheraBand, and you're going to place it on the doorknob like that. And then with your other hand, with your palm facing down, you're going to just pull your elbow is going to be flexed, and then you're going to pull it into extension. Okay. So for parameters, it's going to be 2 sets of 10 once a day, 2 times a week with a light TheraBand. And then Marvin's going to demonstrate. Palm facing down. And for the indications to progress, so proper posture, good form, no compensation, and okay, Marvin. And for precautions, we're going to watch for pain and swelling. And for contraindications, we're going to look for, we're going to make sure if someone had surgery or injury.
So for this exercise, we're going to be talking about forearm pronation. The muscles involved in forearm pronation are pronator teres and the pronator quadratus. So to start off with, we'll have Kim demonstrate. She's going to have her hand or her forearm supported in her leg with about 2 to 3 inches of a gap between her knee and her wrist to give her that room. She's going to start in a supination, and she's just going to, the motion is resisted pronation, so she's going to turn like that. Our parameters are going to be 2 sets of 10 reps, once a day, 2 times a week, with the light band to start off with. When we talk about progression we're going to look at her form, so we're going to want her to straighten up a little bit. Good. And if the band is too light, she's getting a lot of reps in, no problem, that's an indication to progress also. We're going to want to switch to a heavier band. Another indication of progression is, like I said, good form. There's no pain. Obviously, you do want a burn from the exercise, but we don't want pain. We would progress her then to more reps, more sets, or increase the TheraBand, and we have another TheraBand right here, just a heavier one. We can always give her this one so she can progress too. Precautions, again, is going to be pain and swelling. If you see that it's with the exercises, there's that uncomfortable pain that's not normal, or she's getting swelled up right here, we're going to want to stop the exercise. Contraindications are going to be our fractures, a recent injury, maybe as they came in the next day or in the next session and there's something was different, and swell. So forearm supination exercise, the muscles involved with this exercise are your supinator and biceps brachii. Special consideration to the biceps brachii because it is a two-joint muscle. So to start this exercise, Kim's going to demonstrate. She's going to have her forearm resting on the ipsilateral leg. She's going to start in a hammer curl position, as you can see here. From here, she is going to turn her thumb out in an outward motion. Okay, and again, we're going to want to pay attention to the two joints. So because it crosses here and here, we're going to pay special attention to how the elbow is. In this instance, she has it flexed, so the muscle is on lax. If she had it extended, we'd have to pay special consideration that the muscle is now in the top position. Okay, parameters are going to be 2 sets of 10 reps, once a day, 2 times a week, starting with a light band. Now, to progress Kim, if I would see that she has good posture, this is almost too easy for her, she's doing it without any problems, that's an indication to progress her. I would give her maybe a little bit heavier TheraBand, or I would have her just do another extra set or another rep. If that's even too light, then we're going to want to increase it to a heavy band, such as this. And now when we do go heavier, we are going to want to cut the reps down. Some indications, again, like I said, are no compensation. She has good posture, and she's doing it without any problems. Then she's ready to advance. Precautions that I want to be aware of for her is if I do progress her and there's visible swelling, or maybe she's fatiguing too much, or there's pain, then we know that that's a precaution we need to be aware of, and we might want to cut down this, say, from this band back down to a lesser band, medium-sized band. Our contraindications are fractures, injuries, and surgery.
Alright, the next exercise we're going to do is wrist ulnar deviation, which is when you move your wrist towards your pinky, so like you're waving. So 2 muscles act as ulnar deviators. There's extensor carpi ulnaris and flexor carpi ulnaris. So to perform this exercise, what I'm going to have my patient do is she's sitting up with her involved arm supported with the table. The other arm is just going to kind of float up in the air just to stabilize the TheraBand. And what we want to make sure is that she's moving only from the wrist, so she's going to move down and back up. We want to make sure that the only part of the arm that is moving is the wrist. We want to make sure that the elbow isn't moving and that she's sitting up nice and tall. We want to look at this shoulder. We want to make sure she's not hiking it, because we don't want another injury in the good arm. So that's the exercise. So I'll let Courtney rest while I'm going to talk about her parameters. So like the other exercises, she's starting with a red band. That's a lighter band. So other bands we can move on to will have more resistance, such as this one. That can be a progression. She's starting 3 times a week, 3 sets of 10 once a day. And as you noticed, her elbow was bent. So like the other wrist muscles, the ulnar deviators also attach to both joints, the wrist and the elbow. So we're starting, since she started with the elbow flex, that tells us that that muscle was on lax. So to progress it, we can have her perform it with the elbow straight. It would be the same. She would still stabilize above, just this time it's straight and she's moving it down. That's another progression. Obviously this way, if you think of the muscle as an elastic band, it's getting stretched a little more than if the elbow is flexed. That's a progression. The other things we need to be aware of are, of course, uncompensated motions like we talked about, not flexing here or leaning here, no pain, proper form and posture, and then progression. Again, if this is too easy for her, we can just progress a little faster than we were planning. Precautions, pain and swelling in the area, and then contraindications will be an acute injury, recent surgery, or a fracture also in the same area. So the next exercise we're going to do is wrist flexion. Wrist flexion is this motion here when you bring kind of your fingers up towards your... There are a couple muscles that assist in wrist flexion. There's flexor carpi ulnaris, flexor carpi radialis, and palmaris longus. So the parameters that my patient is starting with, 2 sets of 10, 3 times a week, using this red TheraBand once a day with her elbow flexed. So she's starting with her elbow flexed because these muscles are 2 joint muscles. They cross both the wrist and the elbow. So to make it a little easier, we're going to have the elbow flexed to give the muscle a little more laxity. So we're going to show you how she's starting it. So go ahead and hold on to that. She's going to step on the band with her foot, the other foot. What she's going to do is she's keeping her elbow bent. She can put her hand on top of her forearm, not to hold it down, but just as a cue, not to lift at the elbow. The motion's coming only from the wrist. So she's grasping the TheraBand. She's going to lift her hand towards the ceiling and slowly, don't lift your forearm, and slowly back down. Then the wrist is going to come up and slowly back down. That's wrist flexion. So there's a couple of things that we can do to progress this. We can do it with the elbow extended, which, like we said, will make the muscle a little more taut since it's a 2-joint muscle. Other things we can do are change the color of the TheraBand. TheraBands have different resistance. So this is light resistance. We can change it to more resistance. Other things we can do, we can increase rep sets. We can increase how many times a week she's performing this exercise, and some indications for progression. Obviously we want her with good form, so we want to make sure she's performing the exercise correctly. She's not compensating with her trunk or with the elbow. We want it only coming from the wrist. We don't want bad posture. We want to make sure everything is nice and tall. We never want pain or compensation. Precautions, if there's increased pain to where it's intolerable, you don't want to progress that. And swelling. We always want to keep awareness of pain and swelling. Contraindications would be a fracture in between this area pretty much, since that's where the muscle runs. Other things could be recent injuries or surgeries. So with any of those, we don't want to progress. So the next exercise we're going to do is wrist extension. It's pretty much the same setup as wrist flexion, but obviously we're doing a different motion. This is wrist flexion. So a couple things we are going to talk about are the muscles. So first, there are 3 main muscles that are used. There are 3 wrist extensors. So there's extensor carpi ulnaris, extensor carpi radialis longus, and extensor carpi radialis brevis. These all assist in wrist extension. So what we're going to start with are her parameters. So for wrist extension, she has different parameters. She's doing this once a day, 3 sets of 10, twice a week, and she's starting with this red TheraBand with her elbow in flexion. So we want the arm supported, and what she's going to do is she can use the other hand as a cue again, just as a tactile cue, not to lift up. She's gonna stand up nice and tall, sit up nice and tall, and she's gonna bring that wrist up towards the sky, and then she's gonna let it go back down. That's wrist extension resisted. So to progress, we can change the band again to a different color. We can have her performed with the elbow extended. Like we said before, the elbow plays a part in it because it crosses two joints. So having it flex will make it more relaxed. Having it more extended will make those muscles a little more taut. Some indications are, like we said, proper form, pain-free always, and uncompensated. And the rate that she's progressing is also an important thing we need to look at. If this is too easy for her and she's not getting much out of it, we can have her increase reps, sets, band, kind of what we've been talking about. Some precautions are kind of the same, so pain and swelling, we want to make sure that nothing in this area is being aggravated. If it is, we need to tone it down, maybe go to a lighter band or change reps or sets somehow. So contraindications are pretty much the same as for wrist flexion. We want to make sure there's no injury in the area, no fracture, and of course if she has a surgery, we're going to take it slow.
So resisted radial deviation exercise is going to be hitting the flexor carpi radialis and the extensor carpi radialis longus. And what's special about these muscles is they're two joint muscles again. So what we do at the elbow is going to have an effect at the wrist. So we want to be aware of that. Starting this exercise off, Kim here is going to demonstrate. She's sitting. She's going to have her forearm rested on her ipsilateral leg with about 2-3 inches of gap between the knee and her wrist. She's going to start off in a hammer curl position, and she's going to bring her thumb up. She's going to bring it up. So some of our parameters for this is going to be, she's going to do 2 sets of 10 reps to start off with. She's going to want to do these 2 times a week with a light TheraBand. And as you can see, she has good form. She's doing it nice and slow movements. Okay, we don't want jerky movements. We want it nice and slow to really hit those muscles. Progression now is if I see that this band is too light for her, she's doing maybe 15-20 above reps, it's too light for her. We need to progress her to a medium resistance band, something that would maybe look like this. She obviously, another indication is she's doing it with proper form, no compensations. These are all indications again that we want to progress her to something more. And from what I mean to progress is she's starting 2 sets of 10 reps. We want to maybe go to 3 sets of 10 reps. If that's even too light, like I said, we'll switch the band and lower the reps for her. Going back to our 2 joint muscles, one progression is she can start off in the flex position to put that muscle in a lax position. Progression of that would be to put that muscle in the top position, which would be straightening it out. If you can picture that joint right here straightening it out. So having said that, with progressions, we do want to have some precautions as to her progression. If I give her a heavy band, and go ahead and rest back on the. If I give her a heavier band and I notice that maybe now she has some swelling or she's compensating to get that motion, then we're not at a point where she wants to be, and we want to maybe cut back to a lighter band, lesser reps. We want to be aware of swelling and pain. We want to have a burn because she is exercising after all. What we want to be aware of is the precaution is pain. Contraindications for this would be fracture, injury, or surgery. Because it is a 2 joint, we want to be aware of fractures not only down at the wrist, but up at the elbow, because it is going to have an effect again at the motion of the wrist. And this is exercises for radial deviation.